started on New Year's Day, so everything just, yeah.
Came home, cancer, she was pregnant, and so she's like got like a stroke and so for 11 of her kids.
Yes, ma'am.
But the people online will be starting in just a minute here. All right. Well, good morning, everybody. On behalf, good afternoon. And on behalf of the Georgia Cancer Consortium and the HPV Cancer-Free GA work group, just like to thank everybody for coming in today, braving the cold weather. I'd like to thank our online participants for joining us today, and then for our esteemed speakers that we have as well. So today we are here to celebrate all the accomplishments that we have made across the state through our stakeholders and through our providers, but also to dream of the day that we will eventually eradicate HPV-associated cancers, and specifically cervical cancer, from Georgia. So as a reminder, this event will be recorded. It will be posted online on the HPV Cancer-Free GA website. And also, we are going to ask that we just hold the questions for any of our speakers for the end after the event online is finished, or just put them in the chat box and we will be able to answer them in the follow-up email. Next slide. So this event is going to offer continuing education credits. We would just like to thank Piedmont Healthcare for providing and facilitating the credits for this event. Just be sure to fill out the survey at the end of the course if you would like to get credits for that. So before we go any further, this is just a quick starting point to see if you have known or do you know anybody who has been affected by cervical cancer. So for members who are here in person, you can just raise your hand. And then for the online audience, there should be a poll that you can keep your hands raised. Again. A lot. Most people here in the room. We'll give a few more minutes for the online survey. Are we able to do the online? Okay, we'll just put it in the chat box. I see lots of activity in the chat box, lots of thumbs up. So thank you to all who responded. You know, as you can see, there is a really big impact across the state of Georgia for cervical cancer. It impacts many people, either directly or indirectly. And the truth is that cervical cancer is nearly completely preventable. It's a cancer that, through improved access to care, and better medical care, and especially through HPV vaccination, it can be almost completely eliminated. So that's why we're here today, to celebrate these victories and then to continue to push forward so we can get to a state and a world without having to deal with cervical cancer anymore. My name is Brian Boyce. I'm one of the co-chairs of the GC3 HPV Cancer-Free Georgia work group. That's a mouthful. But what we do, along with my co-chair, Astrid Wilkie McKellar, is that we are dedicated to eliminating cervical cancer and the 5 other HPV-related cancers throughout Georgia. And we do this through increased education, advocacy, and improving the HPV vaccination rates across Georgia. I'd like to give a big thanks to our sponsors today. Our gold level sponsor is the American Medical Women's Association, and then also our silver level partners, the Northwest Georgia Regional Cancer Coalition, Cancer Pathways, the Hispanic Health Coalition of Georgia, and the Augusta University and University of Georgia Medical Partnership. We truly couldn't make this event happen without your support, so we thank you. And this event also, by the way, is endorsed by the Georgia chapter of the American Academy of Pediatrics, and so we thank them for their support as well. Here, yeah. So this is our agenda for today, and as you can see, we have a great lineup of speakers today, and so we'll get right to it. Is Representative Anulowicz here? I don't see her right now. We might save that for the next part. So we will skip to the next slide, please. One more. So that really leads us and lets us jump right in. Surprise. Yeah, you're up. So our first speaker today is Dr. Gabby Darville Sanders. And yeah, I got it all. Yep. We all know her pretty well. So she was the previous co-chair of the Georgia HPV Cancer-Free GA work group. She was very passionate about all the advocacy and education and HPV events that we did. And she needed to move to a bigger stage. So take her talents to the national level. So she is now the strategic director of the HPV Roundtable at the American Cancer Society. And we are obviously very proud of her. And we are thrilled that she's here to speak with us today.
I need to have you introduce me like forever. I think I'm just gonna hold it, and I'm also gonna make sure I have my timer so Jana does not fuss at me today. It's always a pleasure coming back. It feels like I'm back home. This is my crew, this is my people, and this is where I got started in the work with HPV vaccination and cancer prevention. And I always look at Leanne because it's always good to be in her presence, and she was the one who connected me with this group. So it's always just a full circle moment. So today I'll be talking about what we're here about, which is cervical cancer awareness and obviously the prevention of cancers associated with HPV vaccination. And so next slide. Before I go in, I'll talk a little bit more about the roundtable because I think a lot of people just don't fully know who we are and what we do and how we support the work that you guys do here in Georgia. And so our roundtable is very much similarly made up like the Georgia work group. We are a coalition of about 80 now members, members from across different key stakeholder groups that help us really advocate and move the needle forward as it relates to the mission, which is to eliminate all HPV-related cancers, starting with cervical cancer, and to really engage in strategic planning and leadership and thought leadership towards that effort. And so we're very excited about the partnership that was forged between the CDC in 2014 and the American Cancer Society. And now we have a strong coalition of just volunteers who help us advance the mission. Next slide. And so this is just like you guys do, we have a coalition of different members. All of them are listed here. We're constantly doing some environmental scans to see who are the new thought leaders, who are the experts do we need to bring to the table, what gaps are there, and who are we missing at the table. And so we've continued to expand our membership and we'll continue to do so in this year. Next slide. So the team leadership, this is the staff. So the roundtable is staffed by 3 persons with the oversight and leadership of our VP. So ACS, if you didn't know, has 6 roundtables, soon to be adding, I think, 2 more in the next year or 2. We have lung, colorectal, navigation, breast, cervical, and HPV. And so we're all fall under Sarah Schaefer, who's the VP of the National Roundtables and Coalitions. And it also includes the Comprehensive State Coalition Partnerships under that umbrella. And then I lead as the strategic director, our staff, followed by Christina Turpin, who is our director, and she's based in Idaho. And then we have Kiera Long, our program coordinator, who's based in South Carolina. So we're all over the place. We have Connecticut, Atlanta, Idaho, and South Carolina, but we all come together and we all work very diligently to support you guys at the individual states and support our members. Next slide. We also are made up of a leadership team. And so our leadership team encompasses our tri-chairs, with one being always an ACS expert. The ACS subject matter expertise and an ACS employee who serves in our roundtable is Dr. Debbie Saslow, who is actually the founding managing director of the National HPV Vaccination Roundtable. So she's been doing this work since 2014, and we are so excited to keep her on in a subject matter expertise opportunity and help us guide the work of the roundtable. She also helps us in giving these presentations. As you can imagine, we have a staff of 3, so we can't be everywhere. And so she, alongside our other tri-chairs, Dr. Rebecca Perkins, who is a representative from ACOG, and Dr. Kristen Oliver, who's a representative from AAP, helps really guide the work of the steering committee. So next slide. And then we also have these lovely persons who are our steering committee. So these are the leaders that are helping us really just help plan the work plan of really the advancement of the work. And so we have Dr. Heather Brandt, Dr. Noel Brewer, very familiar faces, Tamika Felder from Survivor, Jane Gray in California, Nikki Hayes, CDC. We have CDC immunization and cancer control support through our funding. So we have their representation on our steering committee. And then we have Unity Consortium, who they do a lot of adolescent and teenager-faced work. So we're really excited to have them as our steering committee members. Next slide. And so how are we organized? A lot of times people are like, what do you do at the table? We have a lot of different task groups outside of our leadership. So primarily our best practices, also known as our best and promising practices. These are typically our academics, our experts, our researchers who help us kind of push forward the evidence base to support the work. And then we have our state coalitions and roundtables, and actually the Southeast is reconvening and has been reconvening for the last year. And so we're going to head to Memphis next week to meet with the Southeast states representatives, including Astrid from the Georgia work group, to really start action planning and strategic planning for how can we help the states in the Southeast to really improve the work that you're doing. And then we have our national meeting planning and our new emerging leaders program, which is early career development for new emerging leaders, thought leaders in the work of HPV vaccination. And we launched that last year. Very excited about. We have 10 wonderful and beautiful women who are really doing great work across the U.S. And we'll be showcasing their work on February 22nd. So if you want to learn more, we invite you to come and join us on our live webinar to feature their work. And then this year, our best practices added some ad hoc committees. So you'll see a variety of different topics. And these ad hoc committees were not things like we said we need to do. This is ideas and thoughts that are brought to the roundtable from our staff, from our leaders, from our volunteers, from the states to say we have a problem and we need help. So now we have our subcommittees that are focused on IAS forecasting at age 9. How do we get our systems to forecast? How do we get them to switch so that providers and health systems know what to do and how to give the recommendation? We also have data. We know Dr. Bob in Georgia loves data. He helps lead that group for the roundtable, really making sense of the data gaps. We have NIS teen, and then we have, private data, but that doesn't account for all data, right? And, Georgia has your own data. So how do we use the data to our advantage? And then we look at evidence-based interventions, updating our priority research gaps, looking at global work and how can it improve or influence the work that we're doing in the US. And then lastly, one dose. We keep hearing one dose. What does it mean for us? What does the evidence say to support it? We're not there yet, but hey, let's look and start exploring the evidence and come up with some summaries of that. And then more clinically, we're looking at EHR and EPIC for age 9 health plan work, which is our payers, systems, and how they fit into the landscape of improving vaccinations, and then health systems and providing some clinical action guides to improve how health systems work. And so that's how we're, in a nutshell, organized. Next slide. So why are we here? We're here because we have obviously some still high rates of cervical cancer, but we know HPV vaccination works. We now have had, or the HPV vaccine has been around long enough that we have been able to conduct some studies to show its efficacy, right? There's studies in the UK and Sweden that show, after following those who were vaccinated and unvaccinated, specifically women in this cohort study, and they saw that for those who were vaccinated, were almost 88% protected against developing cervical cancer when vaccinated at earlier ages, so before the age of 17. Next slide. There was a study done in England that showed the same effect. In fact, if you were vaccinated by age 13, the effectiveness and the protection was even higher, right? So we know that the vaccine works, and it works to prevent cervical cancer. And so the work is, why are we not, what more efforts do we need to do to get more shots in arms? And that's really where we are, right? Next slide. So current landscape, you're gonna have to keep clicking because it's animated. I try to throw in a little, animation. So this is where we at from 2022, 2023, and now moving into 2024. Next picture. You gotta keep clicking. That's where the effect kind of comes in, right? Yeah, you got it. Next click. Yeah, keep it up. Okay. So NIS team has shown us that for the first time in several years, actually, we didn't see any increase in vaccinations. We actually saw some stalls and some declines in high priority groups, specifically, especially with minority and especially with rural, right? So we're now looking at what do we need to do to kind of catch back up. It's not a lack of effort on our part, it's really the pandemic. And what we saw during the pandemic, next slide, is that well child visits dropped. And this makes sense. Everyone was at home, no one was going into work. And so with that, when well child visits dropped, we saw that HPV vaccinations drop. Next slide. The problem is, though, HPV has not rebounded in the same way as other. Typically, you get HPV, Tdap, and meninge at the same time if the provider bundles. Well, Tdap and meninge has started to rebound. HPV vaccination is still lagging, right? And so this is from private data provided by Merck from that perspective to match with the NIS teen data. And so next slide. This is the outlook currently of what's going on in the United States. And we can see from state to state how each state is doing as it pertains to vaccination and cancer prevention. Luckily, Georgia, I would say you're doing pretty good compared to some of the other states, and Leanne will nod with me, compared to some of the other states that are also having some similar difficulties as it pertains to HPV vaccination. But there's always opportunity, right, to continue to expand and to continue to grow. Next slide. So where are we and what does this mean? It's projected that it can be up to 8 to 10 years, depending on what we do before we can completely rebound as it pertains to HPV vaccination and adolescent vaccination, right? So if we don't do what we should, or we're more lackadaisical in our approach, it could be anywhere up to 10 years. If we're aggressive in our approach, then obviously it can be shorter than that. And so it's not to discourage you, it's just to kind of paint the reality of what projections are currently saying. And so these are some opportunities to really look at what has worked well and what are some opportunities that you guys can take advantage of. Next slide. So the rural reality is that there's a lot of centers and areas in the United States that are rural, right? And we even see in Georgia, Georgia's had seen much growth, right? Everyone's coming here for jobs. We saw this during the pandemic, right? Cost of living is less expensive than other areas, and so they're flocking here. Then we also see in rural areas that there's this mass migration as well. So people are moving from rural to more urban. Now, what does that mean? That means there's access barriers now, there's provider shortages, there's some other barriers that rural populations don't have to their advantage. There's low awareness of vaccination and prevention. And so they also struggle with insurance coverage. And so that's one of the kind of present reality that we're facing with. And how do we bridge the gap and provide that access to HPV vaccination? Next slide. So that's one of the focus of our emerging leader group. Their focus is looking at the geographic disparities, specifically as it relates to HPV vaccination, what states are doing, what gaps exist, and what are some opportunities, right? They're looking at each of the state's cancer plans. Some groups are looking at the cancer plans to see if HPV is included, which cancers are a focus, and what type of work they're currently doing, and what opportunities they can take advantage of. St. Jude, who's one of our members and one of our biggest partners, also has created this wide open space. So if you're ever interested in, I wonder what, some interventions or some programs that have been done in some rural areas and that have worked, I encourage that you go to their landing page. They highlight different states and different areas and different innovative approaches that they've taken to really address it. We worked hand in hand with St. Jude through the partnership. We have a rural think tank. We're continually trying to increase the access of just opportunities that states can take advantage of to really bridge the gap with the rural. Next slide. And then we also see racial and ethnic disparities. And so while the trends differ, we tend to see that Hispanics and Blacks are more likely to initiate, so getting that first dose, but they're less likely to complete. And this is really point of access for racial and ethnic minorities, right? So knowing that, we now have to be creative. We have some states like South Carolina, they literally have a mobile unit and they go to where the people are to provide vaccination. We also know that school-based vaccination clinics work, after-hour vaccination clinics work. We know in the state of Texas, we have some really unique, really innovative partners in the state of Texas. They initiate Project Echoes. And with Project Echoes, they've enlisted community health workers. And we know that community health workers and communities of color are trusted messengers and trusted persons within that community. And so they're more likely to go ahead and get vaccinated through that community health worker intervention, right? All of these opportunities of success. And we also have learned some great things from COVID. I mean, there was a lot of harm and death and destruction, and people were isolated, and there's a lot of issues with happened with the COVID pandemic, but there were a lot of opportunities and learning lessons. So what worked from the COVID-19 pandemic that we can kind of replicate and apply to HPV vaccination? What strategies? Something as simple as a reminder card for HPV vaccination, right? I still have mine in my wallet. Although I don't need it, I have it, right? So what can we take from the pandemic to help improve HPV vaccination? Next slide. So what we ACS and the National HPV Vaccination Roundtable, we encourage vaccinating early starting at age 9. We say that age 9 to up to age 12 is the on time. After 13, you're late. And obviously after that, we want to do some catch up, right? And there's a lot of reasons for age 9. And then we've actually supported and produced evidence-based research this year of over 20 articles that show that vaccinating starting at age 9 has actually shown to have a more increased impacts on completion of the HPV vaccination. Next slide. In total, our studies have shown that it's more time for completion. So even if a parent is not readily like, sign me up to get vaccine at 9, you start the conversation at age 9, so that by age 11, then they're ready to go ahead and get their child vaccinated. A strong immune response. The research literature supports that. We actually is an increased likelihood of getting them before they're exposed, right? And we know that exposure sometimes can be non-consensual. That's the reality. And so we have to protect our kids early as we can. And then there's actually research to show that it actually pulls apart the sexual questions, the sexual activity questions. Parents are less likely to ask all of those questions because they don't associate a 9-year-old with that type of activity. And so they're more likely to go ahead and get their child vaccinated at 9 versus 11 or 12. It decreases the number of shots. We know that right now, or previous recommendation says bundle. Well, when you add flu and COVID, that's what? A lot of shots in one visit. I don't like shots. I don't. Okay. And so if we can pull HPV early at 9, it decreases by 1 vaccine the number of shots they have to get at those well child visits. It's also been shown to be effective. Health system providers and parents are more likely to be willing and in favor of vaccinating starting at age 9. So these are some of the 9 benefits that we highlight in our 9 for 9 video, which is up on our website if you want to use it, and having those conversations with whatever group that you're targeting or working with. Next slide. Our research also says that it increases 30 percentage points for completion rates. It's large increases even with those who have insurance. And then it's 68 to 86% accepted by providers and clinics. So age 9 is where we need to be at with and making sure that our kids are protected. And guess what? Vaccination has no sign of protection waning over time. There's no downside. So why not start early? Next slide. So what does age 9 mean with this? Well, age 9 is a strategy to catch up on well child visits that we missed during the pandemic. But we also want to be in line with the World Health Organization. And if you've been paying attention, we are in some of these countries almost close to eliminating cervical cancer because of such great work that we've been doing. The World Health Organization has set goals of eliminating to a 4 in 100,000 cases through a proactive effort of 90% cervical cancer screenings. I believe it's 70% can't read. No, it's 90% vaccination, 70% cervical cancer screenings, and then 90% treatment. We push at ACS, we're proposing at 90, 90, 90. We need to be at 90%. Now, ACS and both the Cervical Cancer Roundtable, which was launched last year, and our HPV Vaccination Roundtable, this is an initiative that we're taking up this year. And so more to come as a proposal for elimination of cervical cancer and what we have proposed for the United States. Next slide. So Georgia, where do we stand? I love Georgia. I love highlighting Georgia. Next slide. What you do very well is that you look at data. Dr. Bernardczyk was able to come to our national meeting this past year, and this was a poster. I know it's kind of hard to see, but this is the poster that highlighted all of the amazing work that Georgia is doing. You're not only looking at NIST data and possibly some private data, but you're looking also at Georgia-specific data to inform best practices, which not many other states are doing, right? So want to shout out and highlight Georgia for the amazing work that they're doing and how you use this data to inform all of the activities that you're implementing. Next slide. With the Southeast reconvening, we've also done some state profiles. So I'll go over really quickly some of the data that we got as of 2022. So Georgia has increased vaccination coverage of 1 shot. So we've gotten more kids to go ahead and initiate. Now we got to work towards completion, right? So shout out to Georgia. That's a whoop whoop moment for all the amazing work, all the amazing providers, all the amazing health systems. You guys are doing it. Now, we are still a little bit under the national average, but I'm not dismayed by it. You guys are really putting forth the effort. And we saw that, you know, there's a lot of opportunity that still exists. Next slide. So if we look at the demographics, we can tell that across the board in 1 shot, this kind of matches what we said with racial and ethnic. Hispanics and Blacks are higher to go ahead and initiate, but they have lower completion. If I buy insurance coverage, we tend to see that Medicaid and some other insurance coverage options provide them for initiation, but we're not getting to completion, right? Next slide. And then we see urbanicity. That's kind of what we already know. It's easier to access in the city and the metro areas versus in rural. And then we tend to know girls are more likely to start and complete compared to boys, right? Next slide. And so because of that, while 1 shot initiation has improved, we have still seen higher rates of oral and cervical. And I know our focus here is cervical, but you know, we still have a lot of work to do for the state of Georgia. And I'm excited to live in this state because I still get to affiliate with you guys with the work, right? Next slide. And so some best practices and options and opportunities that exist. Where do we go from here? Next slide. So best and promising practices, providers, we know you're burnt out. COVID did a number, right? But you have been our frontline worker in making sure that our kids, our adults are protected for not only just COVID, but also HPV vaccination. And we cannot be successful without our providers in our clinics. So we have some best practices for providers, for health systems, which will be hopefully by sometime soon on our website. These are from our national meeting. But some suggested recommendations. For clinics, we suggest a whole clinic approach. So it's not just the provider, it's not just the nurse, it's the front staff, right? It's the person who's writing the appointment card. It's the person even out front by the door, right? Everyone has to be involved in that vaccine recommendation. Next slide. And then we also say health plans and health payers, our insurance providers. You need to be a part of the conversation. You need to incentivize those who are giving the vaccine so that they're more likely to get this vaccination numbers up. And then our state roundtables and coalitions, we couldn't do without you. We could not do it without you. And I'm over time, but I'm gonna run through it. Next slide. Action steps, start at age 9, really push for and continue to do what you've been doing with your Someone You Love, Lady Gaga efforts, which is increasing access and vaccine knowledge, which I think there's a lot of improvements and work to be done. Policy, advocate, and building the capacity among providers and health systems. Next slide. So I'm just going to have Jana kind of breeze through. We have a lot of resources on our resource website that you can take advantage of. Next slide. We have recordings of forums, age 9. Guess what? We got everything you need. You ain't got to create nothing. Just go and download it and use it, right? Next slide. So we have toolkits, we have videos, we have clinical action guides. We're creating some new ones this year that you can use. Next slide. We have our evidence-based summaries that you can download and hand out. Next slide. And then we have our social media campaigns. You can co-brand if necessary. We have our provider on-demand training series, which is now live and gives you up-to-date topics and training and is accredited. So you get credits and CUs for it and CMEs and all the E's. Next slide. And if you have any questions, contact us. Okay, we're always here to help support you. We couldn't do what we do without you. So that's me. I dropped the mic and I'm sorry, Jenna, that I'm a little over time.
Thank you, Dr. Gabby. That was a amazing talk. Just everything from the organization to all of the materials available to where we stand in Georgia. It's just wonderful. And I put a plug in too because the materials available online are really, really good and amazing. So I encourage anybody who wants them to go check it out. And so next up, we're going to kind of go back. I don't think we have to go back to the slide necessarily, but we do have Representative Terry Anulowicz here with us this morning. Again, she's no stranger to the work group and to our Cervical Cancer Awareness Day. She's sponsored, I think, almost every single one, and she's a big advocate for our work group, HPV vaccination across Georgia, just women's health issues in general in the state. And she is sponsoring a bill in the Georgia House of Representatives to officially announce today, January 18th, 2024, as Cervical Cancer Awareness Day in the state of Georgia. And she is joined by, I'm sorry, Chairman Billy Mitchell. DeKalb County. And so we are thrilled to have both of them with us. And I just like to invite, we have the camera here. If you don't mind, Jug, you might have to jump across some cords here.
Close to get around it. Now,
Yes.
right here. Yes.
There we go. Just like this. There you are.
Excellent. Thank you. Thank you. It is a pleasure to be here again for Cervical Cancer Awareness Day here at the Georgia Capitol. One of the things that we are talking about upstairs in appropriations, of course, is healthcare in Georgia. We know that the HPV vaccine will prevent women in Georgia and throughout the world from getting cervical cancer. We know that it is possible to eradicate cervical cancer in our lifetime. I know, both of my children, my son and my daughter, have received the HPV vaccine through their pediatrician. It is amazing to know that of all that, I mean, there's still plenty to worry about as a parent, but knowing that cervical cancer or any other HPV related cancer is not going to be an issue for my children. If we can scratch one thing off of that list of worries that we have as parents and as caregivers, that's big. And how research regarding HPV and the vaccine has expanded use of the HPV vaccine. That has been critically important. So I want to thank all of the folks who are here with us today in person. I think this might be one of the biggest crowds that we have had at an HPV Day here at the Capitol. Everyone who is online, and thank our sponsors. We've got the Susan Jolley Awareness Program. We've got the Augusta University Medical Partnership. We've got the Hispanic Health Coalition of Georgia. We've got AMWA. We've got Northwest Georgia Regional Cancer Coalition. We've got Cancer Pathways. We've got HPV, CancerFree Georgia. We've got the American Academy of Pediatrics. This is a dream team, y'all. This is a dream team of folks out in the community. It is a joy every year to let the representatives who represent the HPV champions every year know that there is someone in their district, in their community, who is working so hard, again, to help eradicate cervical cancer and to help raise awareness. And it's working, you guys. I mentioned to one of my colleagues today, I said, we've got Cervical Cancer Day. He said, that's the HPV vaccine. Like, yes, that is correct. I remember talking to a colleague last year. He said, that's the vaccine that you won't get cancer, right? I said, yes. He said, he's like, I'm glad we're talking about this. So thank you for everything that you do. Thank you for being here. I'm going to be sharing these statistics, this information with my colleagues in the House when we're back on the floor on Monday. We're going to have this information on everyone's desks. It's been emailed to everyone, and I'm going to make sure that they all know how hard everyone here is working to make sure we are eradicating cervical cancer in Georgia. We are preventing and we are educating, because again, knowledge is power, and being able to share this information it's one of the best things we can do for our community. So thank you to everyone. I love seeing the familiar faces here. Thank you to Chairman Mitchell for joining us today. Thank you to everyone who is here and who made this day such a success. Thank you.
Great. Thank you so much for that. Yeah, absolutely. That's just a testament to Representative Anulowitz's work and the work group's work, just that people are associating the vaccine with anti-cancer. So that is exactly what we want. And so the next part of our program is one of my favorite parts. It's the part that sticks with me the most for long after the event is over, and that's to hear from a cervical cancer survivor. And today we are privileged to have Juliana Ferrone to come and talk about her experience. So thank you so much, Juliana.
Try to hook this up right. Thank you, Dr. Bryan, for that intro. Good afternoon. My name is Juliana Ferrone. I'm very, very grateful to be here with you today. So thank you for the opportunity to address you all about this very important cause. Like many of you, Cancer is not unknown in my family. My maternal grandmother survived inflammatory breast cancer, and my own mother, sitting right here, is a cervical cancer survivor as well. Yes. My story begins with months and months of begging and pleading with doctors in a rural area to see me and take me seriously. In January of 2021, at the age of 27, I was diagnosed with cervical cancer, and I endured numerous surgeries, countless biopsies, a radical hysterectomy, 30 rounds of chemo, 25 rounds of external radiation, and 2 rounds of brachytherapy, which is internal radiation. Overnight, I lost my fertility. I had no children. I was thrown straight into menopause. Exactly 364 days later, I became recurrent metastatic. I had 8 new tumors pop up. So it is a true miracle that I'm standing before you today and sharing my story. Thank you. Thank you. Stage 4A cervical cancer. And it was all because my rural doctors were not listening when I began complaining of the typical cervical cancer awareness symptoms. Because of the confusion around screenings, I believe this is part of what happened to me. So in these photos, you can see a small glimpse of how the last 3 years have gone for me. Lots of tears, lots of prayers, lots of smiles. One photo is me at the hospital. I was waiting to have my hysterectomy, and I call this one of the beginning turning points of my story. And yes, that is me in the red top, completely bald from a rigorous schedule of 8-hour chemotherapy infusions administered every 21 days. I started making the best of it with therapy dogs and fun wigs. But my life drastically changed as a result of this trauma and pain. This is when I knew that I had to become an advocate and make a change, because no one should go through what I did for a disease that's totally preventable. So as a result of my personal experience, I began advocating with a global leading nonprofit named Survivor, spelled CERVIVOR. Because of this community, they help support and inspire and empower anyone that's been affected by cervical cancer. They help to educate and motivate people to use their voices to end the stigma, influence decision-making, and hopefully put an end to cervical cancer. So as we gather here today, it's crucial we shed a light on a silent but formidable adversary affecting women worldwide, which is cervical cancer. We all know the stats. We all know that according to the American Cancer Society, this year alone, 4,310 women will lose their lives to this disease. Despite having a clear solution of HPV vaccination and early screenings, we still see this epidemic continuing. Women are continuing to die unnecessary deaths from cervical cancer. As we've heard before, access to healthcare and OBGYNs remains a concern all over Georgia, especially rural areas. The shortage of these specialized healthcare professionals creates barriers to timely screenings and preventive care for many women. Many lives could be saved if more individuals were educated about the significance of early detection and the HPV vaccination. So to everyone that is here today, thank you. Thank you to all the healthcare professionals, the friends, the family, survivors. I urge each one of us to take action. By working together, we can make a difference. So let's strive to increase those vaccination rates, promote those routine screenings, and definitely get that HPV vaccination. So I believe that together, everyone, we can help eradicate cervical cancer within the next generation and prevent the loss of precious lives. So thank you very much.
Thank you, Juliana. That was really special. I really appreciate your vulnerability and just sharing your story with the group. It leaves an impression for sure about the impact that this cancer can take on people and their families. So next up, we're going to change gears a little bit and go into some of the awards and recognize some of these great practices that are doing an amazing job. And these aren't the only ones in the state, but these are the ones that we're recognizing today. We know that everybody's doing their part out there, but we're going to highlight these for today. These were all nominated by the Georgia Department of Health for their excellent work in vaccinating their patient population against HPV. And so first up, we're going to have we're going to do Imagine Pediatrics first. Imagine Pediatrics is based in Rome, and they were nominated because they have an amazing 90% first dose vaccination rate, and they're following up that with 82% second dose rate. And they sent in a list of ways in which they've engaged everybody in their practice to really boost their rates. And some of those specific efforts have been bilingual educational packets, promoting HPV vaccination specifically as cancer prevention, promoting the importance of boys and girls getting vaccinated. Don't forget that the leading cancer leading HPV associated cancer in men, is oropharyngeal cancer, and that is mostly in men. 90% of that is men. They ensure that no opportunity is missed by reviewing charts before, during, and after visits to make sure that they get every patient who's eligible. And is Dr. Paez here? Is anybody from online? Okay, so she'll be accepting this on behalf of them online. Next up, we have MedLink Gainesville, and that's HRSA Health Center in Gainesville. This clinic is specifically targeted to the uninsured, isolated, and medically vulnerable populations in and around Gainesville. And they have an excellent first dose rate of 84% and a second dose rate of 70%. So very well done and well above our state average. So thank you for what you're doing there. Next up, we have Prestige Pediatrics, and this is a clinic based in Albany, Georgia. And oh, there. All right. Well, stand up. Come on up. Yeah. And so, and they have an excellent first dose vaccination rate of 78%, followed by 66% of their second dose rate. Again, wonderful and well above our state average. So congratulations. And then we, last but not least, we have Wellstar Kennestone Pediatric Associates, and just really otherworldly vaccination rates. They have a vaccination rate of 91% for their first dose and 89% for their second dose. And we have some members here to receive the award, and Dr. Rodriguez is here, who's also a member of the HPV work group.
Yes, he is.
So congratulations to all the HPV champions. This is all a testament to all your hard work, your passion, and just dedication to really tackling this problem. It couldn't be done without all your hard work. And so I do believe that there is a short video that we would like to play as well. Yeah.
Inspired.
Here we are.
Happy to be here. My name is Dr. Rodriguez, Jose Rodriguez. I'm a pediatrician with Wellstar Kennestone Pediatric Associates in Marietta, Cobb County, Georgia. On behalf of all 6 physicians in the practice, Dr. Sandra Rodriguez Fair, my daughter, Dr. Combes, Dr. Yeman, Dr. Yu, Dr. Losk, myself, would like to accept this recognition with gratitude, humility, and pride. I started the practice about 39 years ago. And since 2018, when this event started, HPV Awareness Day, our practice has received this award 3 times, just to show sustainability. The measures that we implemented, how successful are, and how we can sustain them over time. We practice in a framework of prevention medicine. Primary care is all about prevention, having a medical home, examples of nutrition, to prevent comorbidities from obesity, identifying protective factors for the family, relational health, anything that we can do to provide provide strong, safe, stable, nurturing environment and relations. Parental knowledge of childhood development, to generation resiliency, so in time of need, support that the parents need, and so forth and so on. We constantly working to identify surveillance and screening for substance use disorder, attention deficit, underachievement in school, anxiety, depression, suicide prevention, like I mentioned, many things that we're constantly focusing on the patient needs and prevention. Anything that is preventable is public health, population health. We use a biosocial emotional model. And the other frame of reference that we have is that there is so much we can do inside the walls of the practice. About 20% of the outcome of any health condition, prevention, primary, secondary, tertiary prevention, depends on what we do in the office. About 80% is what happened after they leave. We call it unmet social needs, social drivers. People like to refer to them as social determinants of health. About 80% of that depends on those factors. However, what we do in the office do matter too. It's a big component. Policies, processes, and procedures. If you can make those happen at a highest quality, sustainable, that's the key to have increased outcomes, help increase outcomes, positive outcomes. I leave you with 4 tips, the most powerful that we discovered. We start vaccination at 9 and starting on the 4-year checkup. For immunization, we remind them that the next vaccine will be 9. We do pre-planning visit huddles so we don't miss any opportunities of vaccination. We schedule boosters right before they leave, so they have the date set, and parent education. Hope these tips help. Thank you.
Great. Those tips are from a true expert with the knowledge and the real world experience to speak to it. So thank you for that video. That's right. Absolutely. Absolutely. And just briefly, I just wanted to recognize, I think we've had the best support from our legislators ever. We have Representative Cannon here with us. So just wanted to recognize her and thank you for your support. And so next up, we have Triana Arnold-James. And again, she is no stranger to our program. She is actually the force that started Cervical Cancer Awareness Day. Is it 11 years ago? 9 years ago? It's been a while. And she started it with the Susan Jolley Awareness Program. She has tirelessly supported our program. And I actually have no idea how you manage to balance all the places that you go at the both national, regional, and state level. So we're happy to have Triana be able to come and talk to us.
Thank you. I like to move around a lot. Good afternoon, everyone. If I keep it right here, is that okay? Okay. Yes, Triana Arnold-James, 9 years ago, and just to think where we are now, like Terry said, one of the largest crowds that we've had even online, and just to think, and I'm trying my best. I said I was not going to cry. I was not going to cry. Of me walking incognito into the clinics and coming down here at the state capitol with Representative Stacey Evans and meeting with Department of Public Health and saying to them, y'all don't know what's going on the ground. Because when I walked into the clinics, and I said, hey, what are you doing about HPV? What are you doing about cervical cancer? And they pointed me to a poster on the wall. That was it. Now look at where we are. And I got in touch with the American Cancer Society. I got in touch with Department of Public Health. I got in touch with the CDC. And I was mad at the CDC for a while because they had $54 million for cervical cancer and was only giving out pamphlets. And but we made up. We good now. We're good. But that was, that was part of, but let's go back even further. Susan Jolley was one of my best friends, and she gained her wings because of cervical. I did not lose her, because I believe because you all are here, she's winning. She has won this battle. And I remember when she was going through I won't tell y'all the story about me almost getting arrested at Kennestone. Who's from Kennestone? Yeah, they called Cobb County on me. But nobody was telling her what was going on and what was going on with her. And she was doing like we all do when we don't have insurance. We go to the emergency room and we're getting misdiagnoses, we're getting improper, medical care. And with Georgia not expanding Medicaid, I hate to get on that soapbox, but if Georgia had expanded Medicaid, she would have gotten an early diagnosis and a proper care. And that's the mistake that we as citizens, as voters, have made in not pushing. And one thing that I have done since day one is push our legislator, hey, what can we do about Medicaid expansion every year? And then the more and more I got into it and going, and I was not a diva going into these clinics, so they didn't know who I was, right? Going into and asking the questions, what are we doing? There should not be another Susan, right? It should not be another Susan. And we're going to make sure, because all of you all are here, we're going to make sure that there's not another Susan, because that was my person. And it hurts every year. She died actually during Cervical Cancer Awareness Month, January 8th. And, I miss her, because you know how you talk to people every day and you raise kids together and all of this stuff. But I believe that there's a purpose. And she's from the deep South, right? Real country. And she would say, girl, you're going to make me famous. And, and so I have carried her name from the state of Georgia to the Southern District, all the way to, and we're going to talk about that in a few, the call to actions, all the way to the White House, and saying that we got to eliminate cervical cancer. We could do it. We can come together. We can continue to bridge this gap between rural Georgia and metro, and who has access and who don't have access. We could do that. And I thank you all for coming today. I thank you all for being here. And yes, Georgia has improved, and I like to think that I had something to do with it. Like what's her name said on the Golden Globes, I want to thank me. But you all has a lot to do with your providers, your advocates, your survivors have a lot to do with what's happening in Georgia now. And so I just encourage everybody to keep on. We got call to actions that we're going to be talking about in a few. And you talk about all the things that I do. I raised 12 kids, and I'm glad she's back in here, because this is my last child. My husband, stand up, husband. It's my husband. And Jazaria, my last child out of 12. The last one, she'll be graduating this year. And all of my children have been vaccinated with HPV, has the HPV vaccine. And so I believe in vaccines. I believe it's really important. I believe that, I always tell everybody, every woman in my family, hey, it's January, go get them pap smears. And pap smears is not the end all be all. There are other things that we need to do, but as the keynote speaker said, that education is the key, and when we know better, we do better, right? So with that being said, I want to bring up someone that very pivotal in my life. She's my other person besides my family, and I'm just gonna share my space with her. But I'm Triana Arnold James. You all could follow me on Facebook, the Susan Jolley Awareness Program. The video of the entire story is on, so I won't go through the whole thing because of time. So you can go on YouTube and look up the Susie Q story, and that'll tell a lot about the things that I'm missing here. But I want to thank each and every one of you all so much, and those online too. Thank you all so much. You can all follow me, Triana for Georgia. Triana for Georgia. I love my state, especially rural Georgia. because rural Georgia is hurting and we need to do a little bit more. But, if you can, I'm gonna share with Cheryl. Cheryl and I met through Susan. Yeah. And Susan would tell, would say to me, Triana, you gotta meet Cheryl. This is right before she passed. And she said, Cheryl, you gotta meet Triana. Because I believe that she knew that in order for me to do what I do, in order for you to get through what you,
Yeah.
we needed a person. We needed each other.
And I'm just going to say that because I'm standing here in front of you guys right now, battling stage 4 cancer. This woman right here has elevated all of us to be aware of ourselves and to take our purpose and passion and to elevate ourselves to a next level. And I have done that with the wonderful help of her and my business partners, Billy Gray, and also Botanical Sciences, because we are also not only helping educate the state of Georgia, getting your vaccinations in kids, but we're also fighting addiction too. Because just imagine, folks, there's 190 people that are dying a day. It's the size of a 737 aircraft. Could you imagine the media that would be standing at this door if an aircraft went down every day? Because we're losing these lives. We're losing our kids to vaccinations, the same thing. We've got to stand up. Take this conversation to the floor. Take this conversation to our kitchen tables. Let us talk about the issues that are really happening and the kids that are dying, both to not being vaccinated and to the drug addictions out there. We want to say that it's drug addicted kids. No, we're affected by every one of us are affected by it somehow, some way, because fentanyl is literally being laced with a Tylenol. These kids could think they were getting a Tylenol, and guess what? Tomorrow we're burying them. So it's time for all of us to stand up, to take action, to be the Georgias, elevate our health, mind, body, and soul. It's about time we take care of our own action and advocate for ourselves. Thank you all for everything that you do. And please stop by and see us at the end to how we can help you educate you guys and everybody else in the state of Georgia.
Yeah, and get everybody a medical marijuana card.
Yeah, let's get you. I mean, and it's not, and that's what we do. And it's not for everybody, right? That's not the end all be all, but it is an option to change the face of the cannabis user, because I don't choose to use opioids as I fight stage 4 cancer. And I will kick its ass. I promise you I will. I choose to use the medical cannabis because it's given. Doctors, I respect you, but you guys practice medicine. God has my number. And I am on this earth and I'm standing here in front of you because my mission is not accomplished. I lost my son 11 years ago because he got into my hospice. I'm doing CPR on a 14-year-old boy that just pitched a no-hitter at the Little League World Series. 14 years old because he got a hold of my medicine. Let's stand up and talk about the real issues, folks. Let's protect our babies. Start at the age of 9. Let's start at the age of 9 and educate. Let's do it. Thank you all very much.
Thank you. I love you. And I'm going to turn it back over until we talking about the call to action.
Yeah, absolutely. Very powerful. Thank you. Thank you both for sharing. And you don't have to be so humble, Triana. It's not a small part, integral part to putting all this together. Mhm. Well, yeah. And I'm just gonna repeat that for the people online. We have 2 more representatives. Again, this is the best. Yeah, you're welcome to come up. The camera's here. Best showing of representatives that we've had ever. Representative Schofield and Representative Davis are here. So yeah, you got it? Yeah. Yeah, absolutely.
And Representative Cannon.
Yes, yeah. Would you like to?
Representative Viola Davis, Representative Schofield, and Representative Park Cannon. Might I add that they are big supporters of menstrual equity and women health and health period. And I appreciate all them. So if you all look on any bills, you'll find these 3 names.
Well, thank you everybody for being here. I'm State Representative Kim Schofield, and I first of all wanted to recognize you at your people's house. Thank you for coming home. It is so important that as you're doing things and we're making and passing laws that you show up and be present. I started out here as in these seats as an advocate for lupus because I'm a person that's been living with lupus for 24 years. So I understand the struggle is real, and we keep you lifted in our prayers and thoughts and good words that come out. But I also just wanted to let you know that I do have a bill. It's HB 174 that educates women and families in the 6th grade on HPV. And we've been trying to get a hearing on this bill. We've been trying to get this passed. This is the right thing to do in Georgia, and it's people like you that will call our chair people and ask them to give us a hearing and a vote. It's time for Georgia to do different when it comes to people living with chronic disease. We didn't ask for this, but guess what? We're going to move it forward now that we have it. So Kim stands for Keep It Moving, and I'll pass it over.
I am so delighted to be here with you just shortly. I was born at Phoebe Putney in Albany, Georgia, so I am so proud of the Albany folks who were awarded today. Thank you for all that you do for rural families. I did move up here to Atlanta and became a doula and work at Wellstar, so I just want to thank the Wellstar Kennestone folks for all that you do for our families. Lastly, I just want to say, as the youngest legislator here on the minority caucus side, I got elected when I was 24 years old, and I actually was able to start my rounds of HPV vaccine as soon as I was a legislator, and I completed that. And so I stand here today knowing in my body that it was the right decision to make, and would be happy to continue to share my story with any legislators who might be above the age, but might have some folks younger than them who absolutely can benefit from this. So thank you all for all that you do, Triana. You know, we love you. We support you. Representative Vanulowicz, thanks you for all that you do for this issue here in Georgia.
Hello again, I'm Representative Viola Davis, and I won't keep you. I am a critical care nurse and also a veteran serving as an Army nurse. So you know that when it comes to medicine and medical care, without a doubt, we need to just go ahead and expand Medicaid. It should have been done decades ago. We have to put the health of the children, of women, of all the people here in Georgia as a priority and move these issues because that is what the people need. Once again, thank you so much for all that you all do.
Thank you all so much. Thank you.
Amazing. Thank you so much for the support. All right, and so we're going to move into how each one of us can help, and this is geared for people at all levels of healthcare, community action. So these are our calls to action at the healthcare system and provider level. Through HPV vaccination and screening, we can work towards the elimination of all HPV cancers in Georgia, starting with cervical cancer. We can promote health equity through increased access to both HPV vaccination and cervical cancer screenings across Georgia. Deliver consistent messages across all healthcare providers, the importance of HPV and HPV cancer prevention through vaccination. We can work to increase the number of OBGYNs in Georgia. There's a big need for that. And advocate for the passage of House Bill 174 to educate parents on the recommendations for adolescent vaccinations to include HPV, and that's what Representative Schofield was mentioning. And then at the national level, there's the support for the federal HPV prevention. The Prevent HPV Cancers Act of 2023, and that's for a funding bill to fund programs throughout the United States. At the parents and caregiver level, they can check with their healthcare provider to see if their child is up to date on HPV vaccinations. And then for those who are a little bit older, 26 and up, check with your healthcare provider again, because you are still eligible if you have not completed the vaccine series. And then same thing for 27 to 45. So talk with your healthcare provider or pharmacist or nurse practitioner, physician's assistant to see if you would benefit from receiving an HPV vaccine. I got mine, and I'm in my 40s, and so it can help at all ages. So with that, we'll move to the next slide. Yeah. This is, so this is right here. This is,
Oh,
so
that's
that's,
it?
so this is, so I'm gonna let Triana speak a little bit more. This is a link that you can, go to support both of those bills. As a support.
Yes, we have a support letter, and if you all could sign on and scan the QR code, and I believe it's on it's a link on the online on the brochure. Oh, and you're gonna get it in a follow-up email as well, so you can sign on and support HB, the bill Representative Schofield was talking about, HB 174. These are nonpartisan bills, and we need the governor to sign them into law. Because what that's gonna do is that's gonna help us to do more work. If we want to do more work. And give us more access to resources and spread the word education. Even with the bill that Representative Anulowicz produced today, the Cervical Cancer Day. Representative Anulowicz, the resolution bill, does that have a number? Not yet. Not yet. Okay. Okay, and we'll send that out as well in the follow-up email on that number for this Cervical Cancer Day, because we have one in the House and we have one in the Senate. So what that does is that gives us extra support from our lawmakers to do what we do. And then you got the congressional, so that's the state level. Then we have the congressional bill, HB 3633, that is sponsored by Representative Kathy Castor out of Florida. And that's the HPV Cancer Prevention Act, which is gonna give us some federal resources. So you see how that works? So we got state, we got federal, and then I'm also the chair for the National Committee on Global Feminism. So, and I'm working with some doctors, I would say Doctors Beyond Borders, but not that organization, to get the vaccine into the arms of young women and girls and boys in Africa. So, so we're working all levels, and we're working throughout the state of Georgia, and that's why Georgia is so fabulous. So you all just pay attention to the email, make sure you do the survey, and sign on to that support, because that letter, because that's going to help us continue to do what we do. Fair enough?
Awesome.
Thank you. Thank you.
So another wonderful event. Thank you all so much for joining us in person. Again, braving the cold weather and the wind, and for all of our participants online. We just are so grateful that you came and joined us today for this event. If you are interested in connecting with us, if you want to be a part of our work group and join in some of these efforts, we would love to talk to you about how you can do that. You can contact Andre Vassi. He is the email at the bottom left hand of the screen, and he basically keeps us running smoothly with the work group. So we're very appreciative of Andre. And so a big thanks to the Georgia Cancer Consortium, to HPV CancerFree GA, to all of our wonderful sponsors to make this event possible. To Jana. Oh yeah, of course. Yeah, Jana. Yeah. Of course, to Jana. And we just look forward to hosting this event and doing it again next year. There's always more work to be done, but this is what we do, and we're happy to do it. So thank you. And then for those of us who are here in person, there will be a picture opportunity with the Capitol photographer that will be done on the north steps, not the ones right in front of us, because as you've noticed, it's a little bit loud and they're running behind a little bit out there. So we'll meet on the north steps. Great. Thank you.